When they interviewed me for this job, they said, well, I got the typical question, right? Well, why do you think you can do a good job for us? And I said, well, I'm a builder. I build big things, I do big projects. And this is about as big a project as healthcare is going to see in the first half of this century out here. When we're done with this, nobody's going to remember anybody's names who built this electronic highway for healthcare. I mean, nobody's going to, look in a book one day and say, oh, here's the 5 guys who did it, right? But, it's like working on the Union Pacific Railroad, the first network that connected this country. Right? You can say today, well, you know what, my grandfather, worked on that railroad that connected this. So hopefully my kids will say that about me. When this network becomes a reality someday and it's second nature to type in George and it goes across the country and brings back every medical record you've ever had, maybe one of those days my grandkids will say, well, you know what, my granddad worked on that. My grandfather actually helped build that. Incentives for me to get this done are big, and there's no more than just in this living room and in this home. Sari has MS, and like a lot of people who have a chronic disease, it's not something that's going to go away, right? And it's complicated, and you see more than one person. Your care team gets to be quite large over time. When I first met Sari, and we had to go from, the Cleveland Clinic back here and back and forth, we were bringing film, big manila folders of MRI scans. And it was us to deliver it. What, are you crazy? I have to bring this to you, A family practice physician probably sees between 30 and 35 patients a day. And they have 10, 15 minutes with you in that exam room. They say, well, what medications are you on? Well, I have to bring the bag, right? I mean, this is 21st century. I have to bring my bag in, right? So the next doctor knows what I'm on, right? If I don't bring the bag, he says, well, I happen to be epileptic, okay? And he says, well, what medicine are you on? Says, it starts with a D, but it's a big word. I just don't remember. And it says, oh, I said, well, it's a blue pill. Okay. Well, how much do you take? I take 2 a day. Do you know how much is in each pill? Not really. I mean, that's what physicians and providers are faced with each and every day. There's all these empty pieces of information and they just don't know. And as a patient, we don't know. We just don't carry that stuff with us all the time. It's just not a priority in our lives. I'm in handcuffs like everyone else. It is a big ecosystem, our healthcare ecosystem. It is a lot of moving parts owned by a lot of different people out there. And there has to be a new highway to connect all these different moving parts out there. We won't make a dent in these chronic diseases unless we have better tools and better technology tools.